What are the main concepts of this theory? In this slide, we will talk about the main concepts of maternal role attainment, maternal identity, perception of birth experience, self-esteem, self-concept, flexibility, child-rearing attitudes, health status, anxiety, depression, role strain, and gratification. Maternal role attainment is an interactional and developmental process occurring over time in which the mother becomes attached to her infant, acquires competence in the caretaking tasks involved in the role, and expresses pleasure and gratification in the role. The movement to the personal state in which the mother experiences a sense of harmony, confidence, and competence in how she performs in the role is the endpoint of maternal role attainment. Maternal identity is defined as having an internalized view of the self as a mother. A woman's perception of her performance during labor and birth is her perception of the birth experience. Self-esteem is described as an individual's perception of how others view oneself and self-acceptance of the perceptions. Self-concept or self-regard is outlined as the overall perception of self that includes self-satisfaction, self-acceptance, self-esteem, and congruence or discrepancy between self and ideal self. According to Mercer, roles are not rigidly fixed. Therefore, who fills the roles is not important. Flexibility of the child-rearing attitudes increases with increased development. Older mothers have the potential to respond less rigidly to their infants and to view each situation in respect to the unique nuances. Child-rearing attitudes are maternal attitudes or beliefs about child-rearing. Health status is defined as the mother's and father's perception of their prior health, current health, health outlook, resistance and susceptibility to illness, health worry concern, sickness orientation, and rejection of the sick role. Mercer describes anxiety as a trait in which there is specific proneness to perceive stressful situations as dangerous or threatening, and as a situation-specific state. According to Mercer, depression is having a group of depressive symptoms, and in particular, the affective component of the depressed mood. Role strain is the conflict and difficulty felt by the woman in fulfilling the maternal role obligation. Mercer describes gratification as the satisfaction, enjoyment, reward, or pleasure that a woman experiences in interacting with her infant and in fulfilling the usual tasks inherent in mothering.